Christine Fellingham, and I'm back with another Monday Makeover. I'm here again today with Dr. Julian Samuels, a board-certified cosmetic surgeon in her beautiful Norton Commons offices. Dr. Samuels, thanks for being here again today, and thanks for talking again about the issue of intimate female wellness. You've been sort of devoting a few segments to that, and I know that the procedure we're talking about first, labiaplasty, is one that is experiencing a huge growth right now. Mm-hmm. Can you tell me a little bit about why this is happening? Why are women coming to you for this surgery?
Well, I feel like women now feel more open about talking about it to their physicians. There's certainly a conversation going out there among women regarding things that they don't have to live with anymore. If they cause a functional concern or a cosmetic concern, we've finally gotten to the place where surgery is safe and affordable with quick downtime. So what women want labiaplasty for is, number one, they can see the vulva area. Many women shave. There's all information online now. And they have functional concerns with redundant tissue in terms of difficulty exercising or playing sports, or fullness in workout clothing, which is tight-fitting because of the redundant tissue. Also, some problems with intimacy can result. So with today's techniques that we use in plastic surgery, we can hide the incisions. They have less than a week of downtime. They can do this under local anesthesia. Some women choose IV sedation. For me as a surgeon, that's where it started. It began to evolve into the other issues these women were telling me they had: laxity, problems with lubrication, problems with stress urinary incontinence. And so the vaginal devices then were added. The Core Intima is a laser. The Votiva Forma V is radiofrequency. The Exelis UltraFem 360 is another radiofrequency device. And we can customize what we use and on whom with all these treatment options. And then lastly, the O-Shot with PRP.
And the O-Shot works for women of all ages as well.
So we use the O-Shot with platelet-rich plasma. A blood draw is done. We process the platelets gently so that the platelets, which are tied to the stem cells in our blood, once injected into the area, sort of rejuvenate everything in the field. They take on the cell function that we had when those tissues were younger. So it's in an office treatment, minimal local anesthesia and cream. Incredible results. Well over 60% of women achieve results lasting longer than a year after one O-Shot. We can combine it with the chair. All of these devices also work on stress urinary incontinence, so it's a constellation of assistance we can provide.
So Dr. Samuels, I know you're seeing a patient soon today. Can you walk me through what happens when a patient comes to you with these concerns?
One of the labiaplasty patients I did this week was a 19-year-old who had had a traumatic and abusive relationship. The tissue was damaged, and a constant reminder to her of that time in her life. So we fixed that. That was corrective. Other patients, it might be totally cosmetic. With a patient who comes to me with symptoms of stress urinary incontinence, I would probably start with, depending on age, the laser for the older patient, the radiofrequency device for the younger patient. If that takes care of the urinary leakage within 3 treatments, that's great. We do a maintenance treatment at a year. Sometimes we'll add the Emsella chair for even further improvement in both urinary leakage and sexual function. If a patient comes to me and just wants to enhance sexual pleasure, I would start with the O-Shot. If in conversation she said, well, I do kind of leak urine when I cough, jump, or sneeze, I would probably add one of these vaginal devices. And that's really common in this practice, to treat patients with multiple modalities over time if necessary for the best results.
So we have a menu of options, all dealing with women's very real issues and improving their lives with no downtime. Wonderful news again from Dr. Julian Samuels. Thank you so much for sharing this with us today, and thank you for watching another Monday Makeover.